Welcome to this explainer. Let's just jump right in, because if you're joining us today, you probably know the exact, incredibly frustrating journey we're about to talk about. At Vertrae in Dayton, Ohio, Dr. Kamal Woods sees patients every single week who share the exact same story. You've had chronic back pain that has dragged on for years. You've been handed MRI results labeled with things like disc degeneration, arthritis, or general wear and tear. And eventually, you've been told your only real options are to consider major surgery, or even worse, just learn to live with it. And so often, all that frustration just boils down to this one sentiment. Physical therapy helped a little bit. The steroid injections wore off. Am I seriously just supposed to live with this? Listen, if you've been battling chronic back pain for years, bouncing from one treatment to the next, and feeling your hopes slowly fade, I want to validate that experience right out of the gate. So many patients feel completely unheard in this process, and I want to assure you right now, this is not a sales pitch. It's a clearer, medically grounded explanation of exactly why nothing has fully worked for you yet. So why hasn't anything fully worked? Well, today we are going to explore a completely different explanation. This is derived from the clinical insights of Dr. Kamal Woods, and it might finally make sense of everything you've been going through. We are going to look past the symptoms directly at the root cause. Section 1. The muscle you never knew. To really solve this mystery, we have to look past the discs and the arthritis on your MRI to a hidden culprit. Meet the multifidus. It's a deep muscle in your lower back. Now, it doesn't produce the big, visible movements that you'd show off at the gym. What it does is much more precise and, honestly, absolutely critical. It is the primary stabilizer of your lumbar spine. Think of it like a biological gyroscope. It is supposed to be firing constantly in the background, making these tiny little adjustments whether you're walking, bending, reaching, or literally just getting out of bed in the morning. To put it another way, think of your spine as a stack of building blocks. The multifidus acts as the mortar between them. It doesn't let any single block shift dangerously while the rest of the structure is moving. It keeps everything safe and secure. Section 2. The hidden chain reaction. So what actually happens when that mortar fails? The multifidus doesn't usually fail gradually, just from overuse. It fails reflexively. Research shows that after an initial spinal injury, even something like a minor sprain, your nervous system triggers a protective reflex at the spinal cord level. It completely shuts the multifidus off to protect the area. But without that muscle doing its job, your spine has to compensate. Suddenly, your joints, your discs, and your ligaments are forced to take on loads they were absolutely never designed to carry. And that extra load generates ongoing pain, which then retriggers the reflex, keeping the muscle shut off. It becomes this endless cycle. And here is the crucial point. This shutoff pattern often doesn't just reverse on its own. The original injury might be completely healed, but the multifidus muscle stays quiet. Over time, this leads to muscle atrophy and fatty infiltration that actually shows up on an MRI. This means the cycle of mechanical pain just continues, all because your primary stabilizing muscle is functionally absent. Section 3. Why exercise falls short. Now, you might be asking a very logical question right about now. Why didn't all those months of physical therapy just turn the muscle back on? I really want you to hear this clearly. This isn't your fault, and it isn't your physical therapist's fault. Physical therapy works through voluntary effort, right? You consciously engage your muscles. But the multifidus shutoff happens at a deep, involuntary reflex level. It operates entirely below conscious control. You simply cannot think your way through a spinal cord reflex. The problem is upstream. Section 4. Treating the root cause. Let's look at a treatment designed specifically to address this exact mechanistic failure. Enter ReActiv8. It's a small, implantable, restorative neurostimulation system. Here's how it works. It directly targets the specific motor nerve that controls the multifidus. By delivering gentle electrical stimulation directly to this nerve, it bypasses your voluntary pathways entirely and causes involuntary contractions. You just use a handheld controller for 2 short 30-minute sessions a day. Over weeks and months, these repeated contractions slowly wake the muscle back up to rebuild its function. And this is a massive distinction. Traditional treatments often just act to mask the pain signals heading to your brain. ReActiv8 is a restorative therapy. It's not hiding the pain symptom, it is addressing the underlying neuromuscular issue. It's re-educating your muscle at a neural level so it can resume its stabilizing role. Now, because the therapy is restorative, it doesn't give you instant relief like a nerve block would. It takes time to rebuild that muscle control. But look at the published long-term data from clinical trials. Average baseline pain scores dropped from a severe 7.3 down to a mild 2.4 over a 5-year period. That is truly meaningful, durable improvement. In fact, to put a specific number on it, long-term studies report that almost 72% of patients maintained a 50% or greater reduction in their pain over that full 5-year span. Furthermore, a recent 2025 randomized controlled trial reported substantially greater functional improvements for ReActiv8 compared to optimized conservative care. This gives us clear, published, objective evidence of its restorative potential. Section 5. Are you a candidate? Now, of course, it's very important to note that ReActiv8 is not for every single back pain patient out there. Let's break down exactly who this is designed for. This therapy is generally for those with mechanical, axial, low back pain. That means pain centered right in the lower back that gets worse with activity. It is not for the burning, radiating, electric-type nerve pain that shoots down the leg. It's meant for patients who have already exhausted conservative care, but who haven't had prior lumbar spine surgery and don't currently require surgery. Your clinical assessment just has to show clear signs of multifidus dysfunction. Section 6. Taking the next step. So if your story matches this specific clinical profile, what exactly comes next? Well, at Vertrae in Dayton, Dr. Kamal personally evaluates every single candidate to see if multifidus dysfunction is the missing piece of their puzzle. As he puts it, ReActiv8 doesn't treat around that problem. It goes directly to it. That's the motion-first philosophy applied to the root cause. What's really great about this approach is that the process starts with a warm invitation to simply talk. You get a real, thorough evaluation to be heard before any procedures are even considered. We've covered a lot of ground today in this explainer. If you feel like nothing has reached the true root of your years-long pain, I'll leave you with this. Isn't it time to finally find out if your multifidus muscle is the answer you've been waiting for all along? You can begin a real evaluation by visiting Vertrae.com. Thanks so much for joining us.